Hi, I'm Dr. Higham from Clear Vision Center. Today we'll talk about the different vision correction options that we offer here. So a lot of times when you come in, we do a lot of standard measurements. We'll check your vision, we'll check your prescription. We have a lot of conversation about how stable is your prescription. We need to make sure that the numbers are consistent over time. So we check the stability of your prescription, overall eye history. Have you had any injuries to the eyes, any scars? Do you have dryness? We really need to look at the full picture of everything before jumping into a decision with surgery. So we then take you back and do some additional testing. We take some scans. We look at the thickness of your cornea. That's a really big thing when thinking about LASIK, SMILE, some of the other procedures that we offer. We'll take a look at the eyes, look for any scars, look for anything, abnormal on the corneas that will really help us decide what you're a specific candidate for in terms of surgery. So once we have the entire picture, we can talk about different options, what we can offer you to correct your vision. So I'll walk through some of the different options that we have. Number one, LASIK. That's probably the one that most people are familiar with. LASIK involves using a laser. Dr. Vrabek will create a flap or a layer that will very temporarily move over, and then the laser goes in and reshapes the cornea. So most of these laser vision correction procedures involves reshaping the cornea, removing tissue to correct your specific prescription. That's why it's so important to have enough corneal thickness, because when we're removing tissue, we need to make sure you have a good amount of tissue left over. We do a ton of screening images, measurements beforehand to make sure you're in a good spot to have that procedure. After the reshaping is done, we go back in, and this is placed back on the cornea, placed back down, and then Dr. Vrabek takes an extra step and goes in and actually reseals and makes sure that this is properly laid down. After that, it's very normal to be blurry, but that's basically it. So we take care of both eyes at the same time, and this flap starts to heal within even a couple of hours. So right after LASIK, it's normal to be uncomfortable, having some burning, watering, feels like something's in the eye. That's very, very common. What we do at our practice is have you come back, you sit in our massage chair for about 20 minutes just with your eyes closed after the procedure. And this allows your eyelids to kind of seal down that layer a little bit more. Also lets us see how your numbing wears off and make sure that we're not sending you home super uncomfortable. So we can give you artificial tears during that time, really just make you as comfortable as possible. Once you are completely done with the process in our clinic, we encourage you to go home and rest. Usually we say go home, close your eyes for 2 to 3 hours, take a nap if you can. Really just let the eyes heal from that surgery. Afterwards, you wake up and you'll be amazed on how much better you feel. Usually vision, by the next day, you're already noticing a huge improvement. Most of our patients are 20/20, 20/25 on day one, so it's pretty incredible. So there's also a procedure called SMILE. Some people refer to SMILE as small incision LASIK. What SMILE involves is a much smaller incision, hence the name. So small incision LASIK is another vision correction procedure where it's still all with lasers, but there's also a tiny incision made at the very top of the cornea here. The laser still does its job, and then Dr. Vrabek goes in and actually removes a tiny piece of tissue, which is referred to as a lenticule, and same thing, that's what corrects the vision. So with SMILE, the layers of the eye have to seal themselves back down. So with SMILE, it's very normal immediately after to feel foggy. Some people refer to it as looking underwater or having a bad pair of contacts. So that's very, very common immediately after the procedure. Generally speaking, compared to LASIK, there's slightly less discomfort immediately after the procedure, but we still encourage you to go home and rest, close your eyes for a few hours, and then, wake up and kind of live your normal life. So because the incision is smaller with SMILE, the duration of restrictions is slightly less compared to LASIK. For LASIK, we ask that you don't lift anything over 10 pounds for a week. We want you to be careful with bending, anything strenuous, take off for a full week, no makeup for a week, generally just kind of taking it easy. For SMILE, everything's for about 3 days. 3 days of restrictions, and then you're back to your normal life. So lifting, exercising, working out, whatever you want to do, SMILE's great because you can get back to all of that within just 3 days. With PRK, it's another great option. PRK is usually for patients that might not be a candidate for some of the other procedures that we offer. PRK involves using a special chemical that will get rid of this top layer of the cornea. The laser then goes in, does the normal reshaping of the cornea that corrects the vision, And then over time, first couple of weeks of healing, each of those cells grows back layer by layer. So as that happens, you might have some discomfort immediately afterwards for the first week or so. We'll work with you. We follow very closely first couple of days after your procedure. And when we do this, we're changing out what we call bandage contact lenses. So we put a contact lens on the eye, let you heal over. We have you come back in and we're replacing the contacts, each day until things are looking nice and healed. So PRK, in terms of the procedures that we offer, you'll be more uncomfortable than maybe LASIK or SMILE, but the overall outcome is the same. It's another great option if that's the way you want to go. The other procedure that we offer here is EVO ICL. So EVO ICL is a procedure that involves using a implantable lens. So ICL stands for implantable collamer lens. This is a lens that goes in between the colored part of your eye and the lens in your eye. When we talk about EVO ICL, we take lots of measurements on the front end to make sure you're a candidate to have enough space in the eye to put this lens. This is a really great option for patients that don't have that corneal thickness. If you don't have enough corneal thickness, ICL is great because we don't actually remove any tissue. We correct the vision by putting almost a contact lens in that area. So that then goes in and corrects your vision, much like a contact lens on the surface of your eye would. The nice thing about EVO ICL is it's the only vision correction procedure that's actually reversible. For whatever reason, if we needed to remove that lens, we could, and then you'd be back into your glasses or contacts like normal before surgery. One thing we always mention with EVO ICL is there's a small little hole in the middle of the lens called an aquaport. This is a really cool advancement in the technology because it allows your eye pressure to be maintained. The fluid in the eye controls your eye pressure, and this little aquaport allows the pressure to stay stable after the procedure. When they used to do this procedure, they would have to do an additional laser procedure to allow for the eye pressure to be maintained, but because of this extra addition of technology that they've included, they no longer have to do that. I bring it up because some patients will notice a little halo around lights, a little circle around lights for the beginning, usually the first couple of weeks. You might notice it with nighttime driving and headlights, but most people adapt to it very well within a few months. It's really great for patients that have a really high prescription. Our high nearsighted patients do really well with ICL as long as everything else works in terms of the measurements.